Alright, let's cut right to the chase. Mental health, it's a topic some folks still whisper about, still treat like it's some kind of personal failing. Well, I'm here to tell you, that's a bunch of hooey. Welcome to our channel. Today we're diving into some of the most common mental health disorders. Understanding these conditions can help us support those who are affected and reduce the stigma around mental health. It's high time we stop sweeping these issues under the rug and start talking openly, honestly, and with a genuine desire to understand. Because let me tell you, ignorance isn't bliss when it comes to something this important. Ignorance is dangerous. You wouldn't tell someone with a broken leg to just walk it off, would you? So why do we sometimes treat struggles of the mind any differently? These are real conditions, with real symptoms, and they require real solutions. The brain is an organ, just like your heart or your liver, and sometimes it needs help. The purpose of this discussion isn't to label people but to empower you with knowledge. Knowledge to recognize when someone, maybe even yourself, is struggling. And knowledge to know that help is available and recovery is possible. So get ready to open your mind. We're going to talk about what these disorders look like, how they impact lives, and most importantly, what can be done. This isn't about pointing fingers or assigning blame. It's about fostering compassion, promoting understanding, and encouraging anyone who needs it to take that first brave step towards getting help. Because at the end of the day, your mental health is just as critical as your physical health. Let's get started. Now, let's talk about post-traumatic stress disorder, or PTSD. A lot of folks hear PTSD and they immediately think of soldiers coming back from war. And yes, combat trauma is a very real and significant cause, no doubt about it. But here's the reality check. PTSD can happen to anyone who's been through a terrifying event. We're talking about serious accidents, natural disasters, physical or sexual assault, childhood abuse, or even witnessing something horrific happen to someone else. It's not about being weak, it's about the brain's response to an overwhelming, life-threatening experience. It's your mind trying to process the unimaginable. So what does it look like? Well, it's a whole lot more than just feeling a bit down or having a few bad dreams. We're talking about intrusive memories, flashbacks where you feel like you're reliving the trauma all over again, sights, sounds, smells, the whole 9 yards. Nightmares can be relentless, making sleep a battlefield in itself. And then there's the avoidance. People with PTSD will often go to extreme lengths to avoid anything. People, places, thoughts, conversations that reminds them of the trauma. This isn't a choice, it's a desperate attempt to keep the overwhelming fear and anxiety at bay. Then you've got the negative changes in thinking and mood. Maybe they feel detached from others, lose interest in things they once enjoyed, or have persistent negative beliefs about themselves or the world, like I'm bad, or no one can be trusted. And let's not forget the changes in arousal and reactivity. This can mean being easily startled, always being on guard for danger, having trouble sleeping, difficulty concentrating, or having angry outbursts. It's like their alarm system is stuck in the on position, constantly scanning for threats, even when they're safe. This constant state of hypervigilance is exhausting, plain and simple. Living with PTSD can make everyday life feel like navigating a minefield. Relationships suffer because it's hard to connect when you're battling inner demons or when you're constantly irritable. Work or school performance can plummet because concentration is shot and motivation is gone. It's a heavy burden to carry, and it can lead to feelings of isolation, hopelessness, and even thoughts of self-harm. It's crucial to understand that these individuals are not stuck in the past by choice. Their brains are literally rewired by the traumatic experience, and they need help to heal those pathways. But here's the good news, and I always want to focus on the solutions. PTSD is treatable. Therapy is key, particularly trauma-focused therapies like cognitive processing therapy, CPT, or eye movement desensitization and reprocessing, EMDR. These aren't just talk therapy, these are structured approaches designed to help individuals process the trauma, challenge distorted thoughts, and develop coping mechanisms. Sometimes medication can also be helpful to manage symptoms like anxiety or depression. The road to recovery isn't always easy, but with the right support and treatment, people can reclaim their lives from PTSD. Alright, let's move on to a condition that is often deeply misunderstood and frankly, unfairly stigmatized: schizophrenia. This is a serious, complex mental disorder, and it fundamentally affects how a person thinks, how they feel, and how they perceive the world around them. It's not about having a split personality. That's a common myth we need to bust right now. It's more like a fracturing of the usual connections in the brain that allow us to process reality in a coherent way. It can be incredibly frightening and confusing, not just for the person experiencing it, but for their loved ones too. One of the hallmark symptoms of schizophrenia is psychosis, which includes hallucinations and delusions. Hallucinations mean experiencing things that aren't there, most commonly hearing voices, but it can also involve seeing, smelling, tasting, or feeling things that others don't. Imagine hearing voices constantly criticizing you, commanding you, or commenting on your every move. It's not a figment of their imagination in the way we might think. For them, it's as real as me talking to you right now. Delusions are firmly held false beliefs that are resistant to reason or contradictory evidence. Someone might believe they are a famous historical figure, that they are being persecuted by secret agents, or that their thoughts are being controlled by an outside force. Beyond psychosis, schizophrenia can also involve disorganized thinking and speech. Thoughts might be jumbled, making it hard to follow a conversation or express oneself clearly. They might jump from one topic to another illogically, or their speech might be so disorganized that it's incomprehensible. There can also be negative symptoms, which refer to a reduction or absence of normal functions. This can include a lack of motivation, avolition, reduced emotional expression, flat affect, diminished speech, alogia, and social withdrawal. These negative symptoms can be just as debilitating as the more dramatic psychotic symptoms, profoundly impacting a person's ability to engage in daily life. Schizophrenia typically emerges in late adolescence or early adulthood, a critical time when people are usually establishing their independence, pursuing education, or starting careers. The onset can be gradual or sudden, and it can make it incredibly difficult to maintain relationships, hold down a job, or even take care of basic personal needs. The stigma surrounding schizophrenia is a huge barrier to people seeking and receiving help. Fear and misunderstanding often lead to isolation, discrimination, and a reluctance to engage with treatment, which is absolutely vital for managing this condition. The primary treatment for schizophrenia involves antipsychotic medications. These medications can be very effective in reducing psychotic symptoms like hallucinations and delusions, helping to bring a person back to a more stable reality. However, medication is often just one part of a comprehensive treatment plan. Psychosocial therapies, including individual therapy, family therapy, social skills training, and vocational rehabilitation, are crucial for helping individuals develop coping skills, manage stress, improve social functioning, and work towards recovery and a meaningful life. Early intervention is key, so recognizing the signs and seeking help promptly can make a world of difference. Next up, we're talking about bipolar disorder. Now, this isn't just your everyday moodiness or having a good day followed by a bad day. We're talking about extreme, often debilitating shifts in mood, energy, activity levels, and concentration, ranging from the soaring highs of mania or hypomania to the crushing lows of depression. It's like being on an emotional roller coaster that you can't get off, and these mood episodes can last for days, weeks, or even months, significantly impacting every aspect of a person's life. Let's break down these poles. During a manic episode, a person might feel euphoric, incredibly energetic, or intensely irritable. They might have racing thoughts, talk a mile a minute, and need very little sleep yet still feel wired. Judgment often goes out the window during mania. This can lead to impulsive and risky behaviors like reckless spending sprees they can't afford, sexual indiscretions, or grandiose plans that are completely unrealistic. While it might sound like being super productive or full of life to an outsider, mania can be dangerous and destructive, often leading to serious consequences. Hypomania is a less severe form of mania, but still a distinct change from normal mood. Then there's the other side of the coin, the depressive episodes. These aren't just feeling sad, this is a deep, pervasive despair. Individuals may experience overwhelming sadness, hopelessness, and a loss of interest or pleasure in almost all activities. Energy levels plummet, they might sleep too much or too little, experience changes in appetite leading to weight gain or loss, and have trouble concentrating or making decisions. Feelings of worthlessness or excessive guilt are common, and in severe cases, thoughts of death or suicide can occur. This is why recognizing and treating bipolar depression is just as critical as addressing mania. The cycling between these extreme mood states is what defines bipolar disorder. The frequency and pattern of these cycles can vary greatly from person to person. Some people might have long periods of stable mood between episodes, while others might cycle more rapidly. This unpredictability can be incredibly disruptive not only to the individual, but also to their families and friends who are trying to understand and support them. It can strain relationships, derail careers, and make just getting through a normal day a monumental challenge. It's not a matter of snapping out of it or controlling your emotions through willpower. But here's the important part. Bipolar disorder is a treatable medical condition. Mood-stabilizing medications are often the cornerstone of treatment, helping to manage the highs and lows and prevent future episodes. Antidepressants may be used cautiously for depressive episodes, often in conjunction with a mood stabilizer, as they can sometimes trigger mania if used alone. Psychotherapy, such as cognitive behavioral therapy, CBT, or interpersonal and social rhythm therapy, IPSRT, is also incredibly valuable. Therapy helps individuals understand their illness, identify triggers, develop coping strategies, manage stress, and regulate their daily routines, which can be very important for mood stability. With consistent treatment and support, people with bipolar disorder can lead full and productive lives. Chapter 4. Borderline Personality Disorder. Navigating Emotional Storms. Let's talk about borderline personality disorder, or BPD. This is a condition that's often misunderstood, and frankly, it carries a lot of stigma, even within the mental health field sometimes. BPD is characterized by pervasive instability in moods, interpersonal relationships, self-image and behavior, as well as marked impulsivity. Think of it as living in a constant emotional storm where feelings are incredibly intense and can shift dramatically and rapidly. One moment they might feel okay, and the next they're overwhelmed by anger, despair, or anxiety. This isn't drama for drama's sake, it's a genuine and painful experience. A core feature of BPD is a profound fear of abandonment. People with BPD may go to extreme lengths to avoid real or imagined abandonment, which can paradoxically push people away. Relationships are often intense and unstable, swinging from idealization, seeing someone as perfect, to devaluation, seeing them as terrible, very quickly. This black and white thinking, or splitting, makes it hard to maintain stable, healthy connections. They might struggle with a clear sense of self, feeling empty or unsure of who they are, their values, or their goals. This unstable self-image can lead to frequent changes in jobs, friends, or even identity. Impulsivity is another key aspect of BPD. This can manifest in potentially self-damaging behaviors like reckless spending, unsafe sex, substance abuse, reckless driving, or binge eating. Self-harm, such as cutting or burning, and suicidal thoughts or behaviors are unfortunately common in BPD. It's important to understand that these behaviors are often desperate attempts to cope with overwhelming emotional pain or feelings of emptiness, not attention-seeking tactics. They may also experience chronic feelings of emptiness, intense and inappropriate anger, or difficulty controlling their anger, and sometimes stress-related paranoid thoughts or severe dissociative symptoms. Living with BPD can feel like being on an emotional wire, constantly trying to maintain balance in a world that feels chaotic and overwhelming. The intensity of their emotions can be exhausting for both the individual and those around them. It's critical to approach individuals with BPD with compassion and understanding, recognizing that their behaviors stem from immense emotional dysregulation and a deep-seated fear of being hurt or left alone. It's not a choice to feel this way, and it's not a character flaw. It's a serious mental health condition that requires specialized treatment. The good news, and there is good news, is that BPD is treatable, and people can and do get better. Dialectical behavior therapy, or DBT, was specifically developed for BPD and is considered the gold standard treatment. DBT focuses on teaching skills in 4 key areas: mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. It helps individuals learn to manage their intense emotions, reduce self-destructive behaviors, and improve their relationships. Other therapies like schema-focused therapy and mentalization-based therapy can also be effective. Recovery is a journey, but with the right therapy and support, individuals with BPD can learn to build a life worth living. Chapter 5. Autism Spectrum Disorder. Understanding a Different Way of Being. Now, let's turn our attention to Autism Spectrum Disorder, or ASD. It's important to understand right off the bat that autism is a neurodevelopmental condition, meaning it affects how the brain develops and processes information. It's not a mental illness in the same category as depression or anxiety, though individuals with autism can certainly experience those as well. Autism is characterized by differences in social communication and interaction, and by restricted, repetitive patterns of behavior, interests, or activities. And the key word here is spectrum. It manifests very differently from person to person. When we talk about challenges in social communication and interaction, this can mean a variety of things. Some individuals with autism may have difficulty initiating or sustaining conversations, understanding nonverbal cues like facial expressions or body language, or developing and maintaining relationships appropriate to their developmental level. They might not make eye contact in the way neurotypical people expect, or they might interpret language very literally, missing sarcasm or implied meanings. This isn't because they're rude or uninterested, their brains are just wired differently for processing social information. The other core area involves restricted and repetitive behaviors, interests, or activities. This can include repetitive motor movements like hand flapping or rocking, strict adherence to routines and rituals, becoming highly distressed at small changes, or having intensely focused, sometimes unusual interests. For example, a child might be incredibly knowledgeable about dinosaur species or train schedules. These routines and interests can be a source of comfort and predictability in a world that might otherwise feel overwhelming or chaotic to them. Sensory sensitivities are also common, such as being over or undersensitive to sounds, lights, textures, or smells. Because autism is a spectrum, the level of support an individual needs can vary widely. Some individuals with autism may have significant intellectual disabilities and require substantial support in daily life. Others may have average or above-average intelligence, may excel in certain academic or professional fields, yet still struggle with social nuances or sensory issues. The old labels like Asperger's syndrome are now generally included under the umbrella of ASD, reflecting this spectrum nature. There's a saying in the autism community, if you've met one person with autism, you've met one person with autism. It really highlights the diversity within the spectrum. Early diagnosis and intervention are crucial for helping individuals with autism reach their full potential. Interventions can include behavioral therapies like applied behavior analysis, or ABA, speech therapy to help with communication skills, occupational therapy to address sensory issues and daily living skills, and social skills training. The goal of these interventions isn't to cure autism or make autistic individuals normal, but rather to provide them with the tools and support they need to navigate the world, communicate effectively, manage challenges, and leverage their unique strengths. Understanding, acceptance, and celebrating neurodiversity are key to creating a supportive environment where individuals with autism can thrive. Chapter 6. Dissociative Identity Disorder, Understanding Multiple Selves. Alright, let's delve into a condition that is probably one of the most controversial and misunderstood in the realm of mental health: dissociative identity disorder, or DID. You might have heard it referred to by its older name, multiple personality disorder. DID is a complex dissociative disorder characterized by the presence of two or more distinct identity states, or personality states, often called alters, that recurrently take control of an individual's behavior. This is accompanied by an inability to recall important personal information, too extensive to be explained by ordinary forgetfulness. Now, this isn't like the movies portray it with dramatic theatrical switches. While changes in presentation can be noticeable, they are often more subtle. Each alter can have its own unique name, personal history, memories, mannerisms, voice, and even physical characteristics like posture or a need for eyeglasses. The core personality is often unaware of the existence of these other identities, or may experience periods of amnesia or lost time when another alter is in control. This fragmentation of identity is believed to be a coping mechanism, a psychological defense against overwhelming trauma, particularly severe chronic abuse during early childhood. The dissociation itself, the detachment from reality, from oneself, or from one's surroundings, is a key feature. It's like the mind's way of walling off traumatic experiences to protect the individual from unbearable emotional or physical pain. When one alter is out or in control, the others may be dormant or may have some level of co-consciousness, meaning they are aware of what's happening to some degree. This internal world can be incredibly complex and confusing for the person experiencing it, leading to significant distress and impairment in functioning. Living with DID can be incredibly challenging. Beyond the amnesia and the experience of having different identities, individuals with DID often struggle with a host of other symptoms, including depression, anxiety, panic attacks, PTSD symptoms, as trauma is almost always the root cause, eating disorders, substance abuse, and self-harm or suicidal ideation. They may have difficulty trusting others, forming stable relationships, or maintaining consistent employment due to the unpredictable nature of their internal experiences and the memory gaps. It's a constant battle to navigate a world that doesn't understand what they're going through. Treatment for DID is typically long-term psychotherapy aimed at achieving integration, which means helping the different identity states to merge into one cohesive, functional personality. This is a slow and careful process that involves establishing safety, processing traumatic memories, and helping the alters to communicate and cooperate. It's not about eliminating alters, but about fostering a sense of wholeness. It requires a therapist specially trained in trauma and dissociative disorders. While it's a difficult journey with appropriate specialized therapy, individuals with DID can learn to manage their symptoms, heal from their trauma, and lead more integrated and fulfilling lives. Chapter 7. Eating disorders more than just food. Now let's address a group of conditions that are incredibly serious, potentially life-threatening, and often shrouded in secrecy and shame. Eating disorders. And let me be clear, these are not lifestyle choices, phases, or simple attempts to lose weight. Eating disorders are complex mental illnesses characterized by severe disturbances in eating behaviors and related thoughts and emotions. They are associated with an intense preoccupation with food, weight, and body shape, and they can have devastating consequences for a person's physical and mental health. We often hear about anorexia nervosa. This involves an intense fear of gaining weight or becoming fat, a distorted body image, seeing oneself as overweight even when dangerously underweight, and persistent restriction of food intake leading to significantly low body weight. This isn't just dieting, it's a relentless pursuit of thinness that can lead to starvation, malnutrition, and severe medical complications affecting every organ system in the body. The drive for thinness becomes all-consuming, overriding hunger and rational thought. Then there's bulimia nervosa. This is characterized by recurrent episodes of binge eating, consuming an unusually large amount of food in a discrete period while feeling a lack of control, followed by recurrent inappropriate compensatory behaviors to prevent weight gain. These behaviors can include self-induced vomiting, misuse of laxatives or diuretics, fasting, or excessive exercise. People with bulimia are often of normal weight or even slightly overweight, which can make the disorder harder to detect. The cycle of binging and purging is often driven by feelings of shame, guilt, and a desperate attempt to control weight and emotions. Another common one is binge eating disorder, or BED. Like bulimia, BED involves recurrent episodes of binge eating with a sense of lack of control. However, unlike bulimia, these binge eating episodes are not followed by regular compensatory behaviors. Individuals with BED often eat rapidly, eat until uncomfortably full, eat large amounts when not physically hungry, eat alone due to embarrassment, and feel disgusted, depressed, or very guilty afterward. BED can lead to significant weight gain and obesity-related health problems, as well as considerable emotional distress. It's important to recognize that this is not simply overeating, it's a distinct disorder. Eating disorders are not just about food and weight, they are often intertwined with underlying emotional issues like low self-esteem, depression, anxiety, perfectionism, and difficulties coping with stress. Societal pressures regarding body image and thinness can certainly contribute to the development and maintenance of these disorders, but the roots are often much deeper. Treatment requires a multidisciplinary approach, typically involving psychotherapy like CBT or family-based treatment, nutritional counseling and rehabilitation, medical monitoring, and sometimes medication to address co-occurring conditions like depression or anxiety. Recovery is possible, but it often requires intensive, specialized care and a strong support system. Chapter 8. Major depressive disorder, the weight of unseen pain. Let's talk about something that millions of people experience, yet it's still often minimized or misunderstood. Major depressive disorder, or MDD, often just called depression. And I'm not talking about just having a bad day or feeling blue for a little while because something disappointing happened. We all experience sadness, that's a normal human emotion. MDD is different. It's a persistent and pervasive low mood, a loss of interest or pleasure in activities you once enjoyed, and it affects how you feel, think, and behave, leading to a variety of emotional and physical problems. The symptoms of major depression can be overwhelming and can interfere significantly with daily life. We're talking about feeling sad, empty, or hopeless for most of the day, nearly every day, for at least 2 weeks. There's often a marked disinterest or lack of pleasure in all, or almost all activities. You might see significant weight loss when not dieting, or weight gain, or a decrease or increase in appetite nearly every day. Sleep disturbances are common, either insomnia, where you can't sleep, or hypersomnia, where you're sleeping too much. It's a profound shift from a person's usual self. Other common symptoms include fatigue or loss of energy nearly every day, making even small tasks feel monumental. There can be feelings of worthlessness or excessive or inappropriate guilt. Many people with depression experience difficulty thinking, concentrating, or making decisions, sometimes referred to as brain fog. And in severe cases, there can be recurrent thoughts of death, recurrent suicidal ideation without a specific plan, or a suicide attempt or a specific plan for committing suicide. These are not signs of weakness, they are symptoms of a serious illness that needs attention. It's crucial to understand that depression isn't something you can just snap out of or think positive your way through. Telling someone with clinical depression to cheer up is like telling someone with asthma to just breathe better. It's a complex interplay of biological factors, like brain chemistry and genetics, psychological factors like thought patterns and coping skills, and social or environmental factors like stress, trauma, or loss. It can affect anyone, regardless of age, gender, race, or socioeconomic status. It doesn't discriminate. The good news is that major depressive disorder is highly treatable. Psychotherapy, particularly approaches like cognitive behavioral therapy or CBT and interpersonal therapy or IPT, can be very effective in helping individuals identify and change negative thought patterns and behaviors, and improve coping skills and relationships. Antidepressant medications can also be very helpful, especially for moderate to severe depression, by helping to correct chemical imbalances in the brain. Often, a combination of therapy and medication provides the best results. Lifestyle changes like regular exercise, a healthy diet, and good sleep hygiene can also support recovery. The most important step is reaching out for help. Chapter 9. ADHD, more than just fidgeting. Alright, let's tackle attention deficit/hyperactivity disorder or ADHD. Now this is one you've probably heard a lot about, especially in kids, but it's really important to understand that ADHD isn't just a childhood thing. Many adults live with ADHD, and it can significantly impact their lives if it's not understood and managed. It's not about being lazy or undisciplined or not trying hard enough. ADHD is a neurodevelopmental disorder characterized by persistent patterns of inattention and/or hyperactivity impulsivity that interfere with functioning or development. Let's break down those two main categories of symptoms. Inattention means a person might have a hard time paying close attention to details, make careless mistakes in schoolwork or at work, or struggle to sustain attention in tasks or play activities. They might seem like they're not listening when spoken to directly, have trouble following through on instructions or finishing tasks, or struggle with organizing tasks and activities. They might frequently lose things necessary for tasks, be easily distracted by extraneous stimuli, or be forgetful in daily activities. This isn't a choice. Their brain processes focus and attention differently. Then there's the hyperactivity and impulsivity piece. Hyperactivity can look like fidgeting with hands or feet, squirming in their seat, leaving their seat when remaining seated is expected, or running about or climbing in situations where it's inappropriate. In adults, this might look more like a persistent feeling of restlessness. Impulsivity can manifest as blurting out answers before questions have been completed, having difficulty waiting their turn, or interrupting or intruding on others in conversations or games. Again, this isn't intentional misbehavior, it's a challenge with self-regulation that's characteristic of ADHD. Now it's important to note that not everyone with ADHD has both inattention and hyperactivity impulsivity. Some people may have predominantly inattentive symptoms, what used to be sometimes called ADD. Some may have predominantly hyperactive impulsive symptoms, and many have a combination of both. And these symptoms aren't just minor annoyances. They can cause real problems in school, at work, in relationships, and in managing daily life. Imagine constantly struggling with deadlines, organization, and focus, or feeling like you have a motor inside you that just won't switch off. It can be frustrating and lead to feelings of inadequacy or failure, but here's the deal. ADHD is manageable. A comprehensive treatment plan often includes a combination of approaches. Behavioral therapies can teach strategies for organization, time management, and problem solving. Parent training and classroom interventions can be very helpful for children. For many individuals, medications, stimulants or non-stimulants can be highly effective in reducing core symptoms and improving focus and self-control. Lifestyle adjustments like regular exercise, good nutrition, and sufficient sleep can also play a supportive role. With the right diagnosis, understanding, strategies, and support, people with ADHD can absolutely thrive and leverage their unique strengths, because often they are also highly creative, energetic, and think outside the box. Chapter 10. OCD, trapped in a cycle of thoughts and rituals. Let's talk about obsessive-compulsive disorder, or OCD. This isn't just about being a little extra neat or liking things organized a certain way. A lot of people casually say I'm so OCD when they like a clean desk, but that really trivializes what is a very distressing and often debilitating anxiety disorder. True OCD is characterized by the presence of obsessions and/or compulsions that are time-consuming, cause significant distress, and interfere with a person's daily life, work, and relationships. It's a relentless cycle that can feel impossible to break without help. So, what are obsessions? These are recurrent and persistent thoughts, urges, or images that are experienced as intrusive and unwanted, and that cause marked anxiety or distress. Common obsessions include fears of contamination by germs or dirt, fears of harming oneself or others, even though the person doesn't want to, intrusive sexual or violent thoughts, or an intense need for things to be orderly, symmetrical, or just right. These thoughts are not pleasurable. In fact, they are often disturbing and go against the person's values. The individual usually tries to ignore or suppress these obsessions, or to neutralize them with some other thought or action. And that brings us to compulsions. Compulsions, also called rituals, are repetitive behaviors like hand-washing, ordering, checking, or mental acts like praying, counting, repeating words silently, that the individual feels driven to perform in response to an obsession or according to rules that must be applied rigidly. The goal of these compulsions is to prevent or reduce anxiety or distress, or to prevent some dreaded event or situation. However, these compulsions are either not connected in a realistic way with what they are designed to neutralize or prevent, or they are clearly excessive. They provide only temporary relief, and the obsession soon returns stronger than ever. Imagine your mind getting stuck on a terrifying thought, and the only way you feel you can get a moment's peace is by performing a specific ritual over and over again, even though a part of you knows it doesn't make sense. It's exhausting. People with OCD are often aware that their obsessions and compulsions are irrational or excessive, but they feel powerless to stop them. This can lead to feelings of shame, embarrassment, and isolation, causing many to suffer in silence for years before seeking help. OCD can consume hours of a person's day and severely limit their ability to function, but there is very effective treatment available for OCD. The gold standard is a type of cognitive behavioral therapy, or CBT, called exposure and response prevention, or ERP. ERP involves gradually exposing the person to their feared thoughts, objects, or situations, the obsessions, and then preventing them from engaging in their usual compulsive rituals. This helps them learn that their anxiety will decrease over time without the ritual, and that their feared consequences usually don't happen. It takes courage, but it works. Medications, particularly a class of antidepressants called SSRIs, can also be very helpful in reducing OCD symptoms, often in combination with ERP. Recovery is absolutely possible. Chapter 11. Substance Use Disorders, the Grip of Addiction. Now let's address a really tough one, something that devastates individuals, families, and communities. Substance use disorders, often referred to as addiction. And let me be very clear from the outset, addiction is not a moral failing, it's not a lack of willpower, it's not a character flaw. It is a complex, chronic, relapsing brain disorder characterized by compulsive drug seeking and use, despite harmful consequences. It changes the brain's structure and function, making it incredibly difficult for someone to simply stop on their own. A substance use disorder develops when the recurrent use of alcohol and/or drugs causes clinically significant impairment, including health problems, disability, and failure to meet major responsibilities at work, school, or home. This can involve a pattern of tolerance, where increasing amounts of the substance are needed to achieve the desired effect, and withdrawal, where unpleasant physical and psychological symptoms occur when the substance use is reduced or stopped. The person may spend a great deal of time obtaining, using, or recovering from the effects of the substance. the compulsion to use can become so strong that it hijacks a person's priorities, leading them to continue using even when they know it's causing serious problems in their life, damaging their health, destroying relationships, getting them into legal trouble, or costing them their job. They may have a persistent desire or unsuccessful efforts to cut down or control their substance use. Important social, occupational, or recreational activities may be given up or reduced because of substance use. It's a progressive illness that can take over every aspect of a person's existence. Many factors can contribute to the development of a substance use disorder. Genetics can play a role, making some individuals more vulnerable. Environmental factors like exposure to trauma, stress, or early exposure to drugs or alcohol are also significant. Often substance use starts as a way to cope with underlying mental health issues like depression, anxiety, or PTSD, a form of self-medication that ultimately makes things much worse. The substances themselves alter brain chemistry, particularly the reward pathways, reinforcing the desire to use and making it harder and harder to resist. But here is the critical message. Recovery from substance use disorders is possible. It's not easy, and it's often a lifelong journey, but it is achievable. Treatment approaches vary depending on the individual and the substance involved, but often include a combination of behavioral therapies like CBT or motivational interviewing, counseling, and sometimes medications like methadone, buprenorphine, or naltrexone for opioid or alcohol use disorders. Support groups like Alcoholics Anonymous or Narcotics Anonymous provide invaluable peer support and a structured program for recovery. The first step, and often the hardest, is acknowledging the problem and asking for help. Chapter 12, Anxiety Disorders When Worry Takes Over. Finally, let's talk about a group of conditions that are incredibly common, yet can be profoundly disruptive to a person's life. Anxiety disorders. Now, everyone experiences anxiety from time to time. It's a normal human response to stress or danger. It's that feeling of unease, worry, or fear. But for people with an anxiety disorder, the anxiety is more than just temporary worry or fear. It's persistent, it's excessive, it can be overwhelming, and it significantly interferes with their daily activities, job performance, schoolwork, and relationships. There are several different types of anxiety disorders. Generalized anxiety disorder, or GAD, is characterized by chronic, exaggerated worry and tension about everyday life events and activities, often with no specific trigger or with worry that is disproportionate to the actual risk. People with GAD may anticipate disaster and be overly concerned about money, health, family, work, or other issues. They find it difficult to control the worry, and it's often accompanied by physical symptoms like restlessness, fatigue, difficulty concentrating, irritability, muscle tension, and sleep problems. Then there's panic disorder. This involves recurrent, unexpected panic attacks, sudden, intense episodes of fear or discomfort that peak within minutes. During a panic attack, a person might experience heart palpitations, pounding heart or accelerated heart rate, sweating, trembling, or shaking, sensations of shortness of breath or smothering, feelings of choking, chest pain or discomfort, nausea or abdominal distress, feeling dizzy, unsteady, lightheaded, or faint, chills or heat sensations, numbness or tingling sensations, feelings of unreality or being detached from oneself, fear of losing control or going crazy, or fear of dying. These attacks can be terrifying, and people often develop a fear of having more attacks, leading to avoidance behaviors. Social anxiety disorder, also known as social phobia, involves an intense fear or anxiety about social situations in which the individual may be scrutinized by others. They fear acting in a way or showing anxiety symptoms that will be negatively evaluated, that is, will be humiliating or embarrassing, will lead to rejection, or offend others. Common feared situations include public speaking, meeting new people, eating in front of others, or using public restrooms. This fear can lead to avoidance of social situations, which can severely limit their life and lead to isolation. There are also specific phobias, which are intense, irrational fears of specific objects or situations, like spiders, heights, or flying. Living with an anxiety disorder can feel like your mind is constantly on high alert, always scanning for threats, even when there are none. It can be exhausting and debilitating. But the good news is that anxiety disorders are highly treatable. Psychotherapy, particularly cognitive behavioral therapy, or CBT, is very effective. CBT helps people identify and challenge their anxious thoughts and develop coping skills to manage their anxiety. Exposure therapy, a component of CBT, is particularly helpful for phobias and panic disorder. Medications such as antidepressants, SSRIs and SNRIs, and sometimes anti-anxiety medications like benzodiazepines, usually for short-term use, can also be beneficial in managing symptoms. Lifestyle changes like regular exercise, stress management techniques, and good sleep hygiene can also make a big difference. So, we've covered a lot of ground today, and I hope this deep dive has given you a clearer picture of these common mental health disorders. Knowledge is power, folks. The more we understand, the better equipped we are to recognize these conditions in ourselves or our loved ones, and more importantly, to approach these challenges with compassion and empathy instead of judgment or fear. Reducing stigma starts with education, and it starts with conversations like the one we're having right now. Remember, these aren't choices people make. These are legitimate health conditions, just like diabetes or heart disease. And just like those physical conditions, there are effective treatments available. No one should have to suffer in silence or feel ashamed for struggling. Reaching out for professional help is not a sign of weakness. It's a sign of incredible strength and courage. It's taking control of your well-being and saying, I deserve to feel better and I'm going to do what it takes to get there. Thanks for watching. If you found this video helpful, please like, share, and subscribe for more content on mental health and wellness. Remember, seeking help is a sign of strength, not weakness. Take care of yourselves and take care of each other. Let's continue to break down the barriers and build a world where mental health is prioritized, understood, and supported. Because your mental health matters, it really, really does.